Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 milligrams is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Please see the indication and usage statement and important safety information at the end of this video.
Before seeing Dr. Dayani, I had been to several doctors trying to figure out what was going wrong with my vision. I had multiple floaters and my vision was clouded. This happened rather quickly over a matter of days, and so it was really scary. I wasn't sure what was happening. There was this blurry fog that was everywhere. I looked both up, down, far away, it was everywhere. I first saw a regular ophthalmologist and then a neuro-ophthalmologist, but neither could pinpoint what was going on. The neuro-ophthalmologist suggested I see a retina specialist, which was how I found Dr. Dayani. Dr. Dayani is incredibly knowledgeable, and he's very easy to understand. He's straightforward, truly listens to his patients. Dr. Dayani explained to me why my vision was being distorted, and he explained the options for treatment, most of which included being on steroids. I did not like the idea of having to go on oral steroids to treat just my retinal condition. And this is how, together, we came to the ultimate conclusion that YUTIQ would be the best option. Prior to being treated with YUTIQ, I went to Dr. Dayani's office every 6 to 8 weeks to get injections in my eyes. And that is as scary as it sounds. And while Dr. Dayani does everything possible, including hiring awesome staff, to make the experience as bearable as possible, you're still getting needles in your eyes. I had a steady stream of family and friends accompany me to every single appointment, and each person who came with me came away from the experience being shocked that there wasn't a better way to treat my disease. The treatments are time-consuming, they're anxiety-provoking, and as such, the impact of having to go so often was pretty sizable. The idea that I would not have to submit my eyeballs or my psyche to the trauma of receiving injections every 8 weeks was my main motivation. The injection process of YUTIQ is absolutely no different than that of receiving any other injection to the eye. It was no more or less painful or uncomfortable, didn't take any longer. It's really easy, especially for somebody who at that point was used to getting needles stuck in their eyes. My vision has been much clearer. I do sometimes need to supplement it with steroid drops, but nothing at all like I had to do before the treatment. It's great. I still go see Dr. Dayani every 8 weeks to check my pressure, which has always been good, but I can go to appointments alone and I'm in and out. Most important for me, I haven't had to have a needle stuck in my eye in over 2 years, which is a welcome change. I'm deeply grateful to science and to Dr. Dayani for being so assuring and comforting when presenting this treatment as an option. I will forever be grateful.
Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 milligrams is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Important safety information. Contraindications. Ocular or periocular infections. YUTIQ is contraindicated in patients with active or suspected ocular or periocular infections, including most viral disease of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Hypersensitivity. YUTIQ is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injection-related effects. Intravitreal injections, including those with YUTIQ, have been associated with endophthalmitis, eye inflammation, increased or decreased intraocular pressure, and choroidal or retinal detachments. Hypotony has been observed within 24 hours of injection and has resolved within 2 weeks. Patients should be monitored following the intravitreal injection. Steroid-related effects. Use of corticosteroids, including YUTIQ, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Risk of implant migration. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development and increases in intraocular pressure. Please see full prescribing information.